In my view, many schemes in the budget are a continuation of the strategic agenda laid out in previous years or are jigsaw pieces of a longer-term plan fleshed out elsewhere.
Leader of the opposition Pritam Singh opens the budget debate, focusing on inequality, jobs and the government's expenditure.
COVID-19 breaches during the CNY festive period. 4 F&B outlets ordered to shut and 234 people fined.
Following a fire at an industrial building in Tuas this morning, 8 people were taken to the Singapore General Hospital for burn injuries.
Welcome to The Big Story, coming to you live from the Straits Times newsroom. I'm Olivia Quay.
I'm Haryanto Diman. You can subscribe to the Straits Times channel so you never miss a single episode.
From today until Friday, MPs will be debating the 2021 budget statement, which Deputy Prime Minister Heng Swee Keat delivered last Tuesday.
Kicking off the proceedings, Leader of the Opposition Pritam Singh asked for clarity on several initiatives, particularly those that aim to improve job opportunities, especially for older workers.
This is in light of the fact that a significant number of workers will also enter their 50s by 2030. The effectiveness of government measures should be readily determinable. Without such scrutiny, a perception may crystallize of large sums of money being deployed to address an issue for which effectiveness is hard to establish. This follows on from my call in September for more and not less information from the government. I encourage Singaporeans to look out for the reports of the Estimates Committee, a standing parliamentary select committee, one of whose roles is to examine the government's budget. If the government would consider a more aggressive reset in this regard, the establishment of an independent parliamentary budget office may well be another complementary addition towards the judicious use and accountability of taxpayer dollars.
Mr. Singh also called for the government to deeply assess how the pandemic has affected low-income households and their employment prospects.
He supported DPM Heng's plan to raise salaries for nurses, but hoped the same could be done for other frontline workers.
Like many Singaporeans, a high point for me in DPM Heng's budget was the announcement of a hike in the salaries of our nurses and healthcare professionals. A crisis usually leaves lasting lessons about those you can count on and who are always there in one's most challenging times. Healthcare workers deserve their raise. I would urge the government to look at reviewing the wages of other frontliners, and particularly essential workers like our waste disposal workers, transport workers, and many others who proved indispensable in this COVID-19 fight.
Mr. Singh touched on the rise in petrol duties as well, which came into effect on budget day, while road tax rebates would only be given at a later date.
The hikes were part of the Singapore Green Plan 2030 goal to nudge Singaporeans towards electric vehicle adoption.
I urge the government to review this budget announcement and implement a more thoughtfully phased-in increase of the petrol duty in proportion to the actual growth of EV usage on the roads. The rebates proposed can be given out in a similarly phased manner. Such a move will be fairer for road users as compared to the minister's current plan, which is also implicitly contingent on a large number of EV charging points becoming available in 12 months' time when the subsidies end. In comparison, the government's roadmap for 60,000 EV points has 2030 as its end date.
Meanwhile, Bukit Panjang SMC MP Liang Eng Hwa noted that the $11 billion COVID-19 resilience package and the $900 million household support package are necessary to tackle the ongoing COVID-19 crisis and strengthen social safety nets.
While he supported the drawing on reserves to fund the COVID-19 resilience package, he said Singapore should also consider alternatives instead of tapping on Singapore's reserves, which have been used to tide through the last 2 financial years.
He talked about the government's plan for the GST hike as a way to finance the current spending needs.
Last year, I asked the DPM as to who pays the biggest shares of the GST based on past collections. He shared that foreigners residing in Singapore, tourists, and the top 20% residents' household account for 60% of the net GST borne by all households and individuals. This is significant, And we do want to collect more taxes from the top 20%, household and the foreigners. In this budget, DPM reiterated the government's assurance that should GST be raised, the $6 billion assurance package, which have already been set aside in the GSTV fund, will kick in and help cushion the impact for the low and middle income household.
Lots more to digest from today's budget debate in Parliament. So let's bring in political correspondent Lynette Lai. Hi, Lynette. Lynette, last year the 5 budgets focused on managing the pandemic. Now, while this year's budget still has some COVID-19 elements, the focus has largely returned to addressing long-term plans that were set pre-pandemic. What were the main topics or concerns raised in today's debate?
So as you said, this year's budget really has shifted away from emergency measures like we saw in last year's 5 budgets, and we are looking a lot more at long-term plans, but at the same time it's not a return to the status quo before the pandemic. What we saw MPs talking a lot about just now was, of course, jobs. How do we invest in Singapore's talents, especially at a time when the economy is weak? How do we help businesses who need help and help those who can pivot to other industries pivot? We also saw talk on sustainability, so that's where the electric vehicles and petrol tax, these issues came in.
On that subject, in his speech, opposition leader Pritam Singh addressed the hike in petrol duties, like you mentioned, that came into effect immediately on budget day, but the road tax rebates would only come in later. So Lynette, other MPs, they raised similar concerns on this topic. What did they say?
Yes, so of course the biggest issue is cost. So some MPs raised concerns about whether unscrupulous companies might pass on the costs to consumers. They also asked, because the reason that we've been given for this petrol tax hike is to encourage Singaporeans to move towards electric vehicles. But of course, not everyone can switch to an electric vehicle immediately. So, and these groups of people will be affected by the petrol tax hike, which, as you pointed out, has taken place. You also have taxi drivers and private hire car drivers who were quite hard hit by the pandemic, and they will be hit by this also. In the longer term, other MPs have pointed out that we may not have the infrastructure in place for widespread electric vehicle adoption, so that is an issue that needs to be sorted out.
Something else that Mr. Singh brought up was the recommendation to increase salaries for nurses. Now, it didn't have a big place in the budget statement, but this issue was brought up by other MPs as well. What were the shared concerns?
So one concern brought up by Workers' Party MP Faisal Manap is that there was a study in 2018 that found that nurses in Singapore are paid less than their counterparts in Australia, for example. And since Singapore does rely quite a bit on foreign nurses, it could make it harder for us to keep the nurses that we have. So remuneration, although there's no details yet on this salary increase, but he's basically underlining the point that remuneration is very important. Apart from that, Ang Mo Kio GRC MP Daryl David also brought up the fact that apart from salary, there needs to be a good career progression pathway and good workplace environment. For example, people may not join the profession because there's long working hours. They may face abuse from patients' families, and these things tend to turn people off. So it would be good, he said, for the government to look into them.
Good point. Well, of course, today's budget debate is still going on as we speak, but looking at the 2 examples that we just discussed, Lynette, it seems like the ruling party and the opposition have similar concerns. Are they looking in the same direction, though?
I think broadly, yes, everyone's looking in the same direction. They recognise that Singapore is in a place where it is recovering, but things are still very dicey. There are certain sectors of the economy that need more help. Where they differ perhaps is where each party wants to draw the line on what help should be given, how much help should be given. And as the Workers' Party has always said, they are there to provide a check and balance. And sometimes they also, their value is also in questioning the fundamental assumptions that Singaporeans may have about the way things are done or should be done. For example, Mr. Singh earlier brought up how we should make sure that all this money that is being spent on COVID-19 help is well spent, and the importance of accountability, of transparency.
Well, thank you so much, Lynette, for setting aside time to join us in the studio to share more on this. Always a pleasure to speak with you. That was political correspondent at the Straits Times, Lynette Lai.
Well, also in Parliament, Education Minister Lawrence Wong said all height-based outdoor educational activities will remain suspended until MOE completes its review of the incident that resulted in the death of the ACS student Death Row Phua. Findings and recommendations will also be shared then.
Mr. Wong was responding to MP Vikram Nair, who asked for an update on the investigation and whether there were lessons to be learned to prevent future accidents. But he was unable to comment on the specifics of the incident.
Let me first express my deepest condolences to Jethro's parents, family members, and loved ones. We are unable to comment on the specifics of the incident as the cause of Jethro's death is still being investigated by the police. MOE is also undertaking its own review on the conduct of height-based outdoor education, and we will share the findings and recommendations when the review is completed. Meanwhile, all such activities will remain suspended.
Meanwhile, Senior Minister of State for Health, Janil Puthucheary, said healthcare workers involved in the COVID-19 vaccination process should leave their positions only after the immediate task has been completed. If there is a need to step away, Dr. Janil added that there must be proper documentation and handing over of duties to other staff members.
He was responding to 3 parliamentary questions on the recent vaccination overdose incident at the Singapore National Eye Centre. On how public healthcare institutions manage staff workload to prevent them from overworking and thus avoiding human errors, Dr. Janil noted there are rostered breaks and clearly defined roles undertaken by all employees across the stations.
To ensure that each staff member in the vaccination process is assigned a manageable workload, there are specific stations within the vaccination sites for registration, screening, vaccination, and monitoring. There are clearly defined roles undertaken by staff across the stations. Staff should leave their positions only once their immediate task has been completed. And should there be a need to step away, there must be proper documentation and handing over of roles and duties to other staff members. The public healthcare institutions, the PHIs, have planned rostered breaks and staff rotations so that staff have sufficient rest during and between their shifts. The PHIs will also continue to train and hire more healthcare professionals so that there will be adequate staffing to cater for these work-rest cycles and meet service demands.
Also in the local headlines, 8 people were taken to Singapore General Hospital for burn injuries after a fire at an industrial building at Tuas Avenue 11 this morning. Witnesses said they heard a loud explosion. The Singapore Civil Defence Force said on Facebook that about 65 others in the vicinity had evacuated before firefighters arrived. The fire involved an industrial mixer in the affected unit and was extinguished with 2 water jets. Its cause, though, is under investigation.
Non-executive chairman and director of Keppel Court, Lee Boon Yang, will retire from his post on April 23rd. After nearly 12 years of helming the board, Dr. Lee will be succeeded by Danny Teo, who's Keppel's current audit committee chairman and member of its remuneration and board risk committees.
On the COVID-19 front, 7 new cases were confirmed today, including 1 in the community.
The remaining 6 cases were imported and placed on stay-home notice when they arrived here. The Health Ministry will share more details tonight.
4 F&B outlets, including Club 1 Min in Concord Shopping Mall, were ordered to close for breaching safe management measures. The second offender club was found to have allowed gatherings of more than 8 people. It also had hostesses intermingling with patrons on February 19th. The establishment was ordered to shut for 20 days. The other 3 outlets were ordered to close for 10 days after diners were found consuming alcohol after 10:30 p.m.
13 more eateries, including Shi Li Fang at Orchard Central, Ronghua Bakute at Waterway Point and Basil Thai Kitchen at Paragon were fined $1,000 each for breaking COVID-19 rules. Separately, 234 people were each fined $300 over illegalities at parks and beaches like group gatherings of more than 8 people.
The last 4 members of a 12-person group who illegally gathered on Lazarus Island last year were each fined $3,000 today. It's the same punishment the other 8 people were dealt. The British nationals pleaded guilty to a charge of meeting others for a non-permitted purpose and without reasonable excuse under the COVID-19 regulations.
In an update last Friday, some 250,000 Singapore residents have received their first dose of the Pfizer-BioNTech vaccine, and about 110,000 have completed the vaccination regimen.
Of course, this number has risen since then, with vaccinations rolled out for seniors and taxi and private hire car drivers from this week.
Now, if all goes well and there are no disruptions to the supply, Singapore can reach its aim of getting 1 million more people vaccinated by April. Singapore should be able to fully open its borders and life can start returning to normal, only if everyone who is eligible gets vaccinated and is protected against COVID-19.
If a significant portion doesn't get the jab, it can jeopardize the entire program.
The percentage of people who need to be vaccinated depends on the R0, the reproduction number, indicating how transmissible the virus is.
Let's get an expert's view with Associate Professor Alex Cook, Vice Dean of Research at the Saw Swee Hock School of Public Health. Welcome back, Professor. So, what is the present R0 in Singapore, you think?
So there are actually 2 different reproduction numbers, and I think it's important to realize a distinction between those. There's what we call the basic reproduction number, or R0, R0, and that is the amount of transmission from one person to subsequent cases in the absence of any measures to try to control transmission. There's also another kind of reproduction number, which we call the effective reproduction number. And this would typically be lower because for most of the pandemic so far, we've been making efforts to try to reduce the risk of transmission from person to person. It's actually quite difficult to know what the exact values of these are for reasons I'll explain. So in Singapore, we have always been trying to control the pandemic ever since a year ago when we first started getting cases imported in. And because of that, we've never really experienced what the basic reproduction number, or the R0, is, because throughout all the last 12 months, we've been suppressing it to a lower effective number. So for us to know what the basic reproduction number is in Singapore, we really have to look overseas and try to estimate. So if we look at Wuhan was the first place to experience large-scale transmission. And so before they went into lockdown to try to prevent the epidemic, we're able to kind of get a sense from the initial rise in number of cases as to what the reproduction number was there. We can extrapolate that might apply in the Singapore context. So the first estimates that have been made for what the Wuhan reproduction number was like was somewhere between 2 and 3, meaning that one person would infect between 2 to 3 people on average in the absence of control. Now, of course, that doesn't directly apply to Singapore because for the last 12 months, we have been working very hard and quite effectively to control transmission. And so that means that we're at an effective reproduction number, which is less than the basic reproduction number, and probably even less than 1. That's why we're seeing imported cases not leading to sustained local transmission of infection. So I would guess that the effective reproduction number right now is less than 1, but we don't know what it would pop up to when we start relaxing some of the control measures, such as safe distancing, and the other forms of safe management measures we have in place. So it may go back in the absence of any vaccination and the absence of any other control. It may pop up to somewhere about 2 to 3, but we're not quite sure at this point in time.
Professor, if the R0 is higher, it means more people need to be vaccinated to achieve herd immunity. What happens though if that percentage of people is higher than the percentage of people actually eligible for vaccination?
So if not enough people get vaccinated according to the limit that we need to reach in order to get herd immunity. Okay, so if we exceed the limit that we need for herd immunity, that means that society has become, in a sense, like invulnerable to the epidemic. We'll still see cases coming in, but there won't be enough immunonaive people, so people who've never been infected before or never been vaccinated, for epidemics to spread at that point. If we don't reach that level, right, for a lower level, then that means that society is in effect still vulnerable to having epidemics. So those who have been vaccinated would probably not get infections, but those who have not been vaccinated, for example, kids, those who are not able to get vaccinated, maybe they're pregnant, they're worried about the risk to their pregnancy, or those who refuse to get vaccinated, they would then be at risk of getting infection in epidemics that could happen. So I can see these kind of two different paths that could play out if we don't reach the level of vaccination coverage that we need in order to get herd immunity. So one of the paths would be that we continue to have all of the safe management measures in place. Therefore, everyone in society is effectively going to suffer as a result of that. We won't be able to travel. We're still going to have some workplaces on split mode and so on. So that would be one of the paths that we might end up at. So if not enough people are vaccinated, then basically everyone has to continue to hand the extra safe management measures in order to keep epidemics from happening. On the other option that could happen would be that we decide that we've rolled out the vaccine, not enough people have taken it, but everyone's had the chance to get it who's eligible for it. And therefore, we decide that we would relax all of the measures that we have in place to try to prevent the epidemic. Now, if we've not reached the level of herd immunity that we need to get to, then that means that if we're relaxing all of our measures, then the reproduction number is going to pop back up again, and we're going to start seeing epidemics forming. And it'll be a bit like what it was in the first quarter of last year. Now, those epidemics would then be preferentially occurring amongst those who have not been vaccinated. Some of those people will be those who decline to get vaccinated, but others would be people who are not able to, for example, because they were too young and the vaccine's not been tested out in kids yet, or because of health issues, or they're pregnant or whatever. And so I think that it's important for those who are able to get vaccinated that they should get vaccinated, both to protect themselves, but also to prevent us from going down that route, which would expose other people to risk of getting infection.
Well, thank you, Professor. As always, we appreciate your insights. We've been speaking with Associate Professor Alex Cook from the Saw Swee Hock School of Public Health at NUS.
Looking overseas, Prime Minister Muhyiddin Yassin was the first person in Malaysia to receive a COVID-19 vaccine today at a public clinic in Putrajaya. Starting its vaccination drive 2 days ahead of schedule, the country aims to inoculate close to 83% of its 33 million population. Healthcare workers and other frontliners will get first priority. The general population will be vaccinated from May.
Hong Kong's financial secretary pledged 120 billion Hong Kong dollars of fiscal support targeted at consumers and the unemployed to help boost an economy emerging from 2 years of recession. The measures include spending vouchers of 5,000 Hong Kong dollars for each resident and $15 billion of guaranteed loans for those without jobs. The vouchers should help stimulate spending, benefiting restaurants, retailers and tourism businesses.
Tiger Woods came away from this wreckage with serious injuries to his right leg as well as the bones of the foot and ankle. He has undergone surgery in a Los Angeles hospital and is currently responsive. Woods' SUV had veered off the road, rolled down a steep hillside and ended up on its side with its windows smashed. Rescue crews had to extricate him from the badly damaged car, but he was conscious and able to communicate. According to police, the airbags in the vehicle deployed. Woods was also wearing a seatbelt, which the LA County Sheriff said likely saved his life. He said as well that Woods' car was, quote, going at a relatively greater speed than normal. There were no signs of impairment, but tests are being conducted.
In addition to several golfers tweeting their support for former US President Barack Obama, also wished Woods a speedy recovery. Footballer Gareth Bale and retired swimming champion Michael Phelps' messages were short but no less heartfelt.
Well, those are our top stories for today. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below.
Once again, I'm Haryanto Diman with Olivia Quay. Join us tomorrow for more stories on The Big Story.